Hi everyone, I'm Dr. Larsen. Welcome to the video. I want to talk about the knee pain, Popliteus gallbladder connection. Popliteus is a little muscle in the back of your knee, and it has this strange connection with your gallbladder. Now, I didn't make this up. I didn't discover it. It's been around for decades. The founder of applied kinesiology, Dr. George Goodhart, was one of the first people that I know of to discover this. There's probably others as well, probably in Chinese medicine and whatnot. But this connection here is really important. And I know it is because I find it in my patients a lot. And the gallbladder is so big. Probably my most popular video or my most watched video on YouTube has to do with the gallbladder. So what it tells me is that a huge part of our population is struggling with these issues. And I get a lot of patients in who have gallbladder issues as well, and a lot of people with knee pain. So this connection here is really important to make. Now, there's other reasons for knee pain. There's lots of different reasons for knee pain. But if you've never had a trauma, if you've never had an impact injury or something happen to your knee, yet you have knee pain, this muscle here and this gallbladder are things to check. So the popliteus is a muscle in the back of the knee. And what it does is it unlocks and locks your lower leg. Now, I don't have a model here, but just think of it that way. It just rotates the lower leg. And when it doesn't work exactly how it's supposed to, maybe it's a little sluggish, maybe it's a little slow, it's not coordinated correctly, that's where grinding starts to occur. Little micro traumas over time. So even people who have had or need a knee replacement surgery, many of them have never actually had an injury to the knee. It just wore out over time. Now, why did it wear out? That's always the question. Was it truly because of the job that they had? They were a construction worker or whatever they were doing, or was there other reasons for that? And I find this a lot because liver, gallbladder kind of go hand in hand, and these organs are very stressed in our society, and it causes a lot of this popliteus problem with knee pain. Now, a story for you. My first few years in practice, I had a young girl come to me. She was a softball player. She was a catcher, very good one, is from what I hear. And she couldn't play because she could not squat down. Her both knees hurt really bad. In 3-4 weeks, she was going to the athletic trainer. She was going to the physical therapist, and they couldn't quite figure it out. And her first baseman was a patient of mine, referred her in. So you've got to go see this guy. He's going to look at you differently than what they're doing. And I did. And I did my whole muscle testing routine. I checked every muscle around the knee, checked every muscle around the ankle, the hip, the spine, everywhere. And the glaring weakness was in that popliteus muscle. So I found that the popliteus muscle was weak. I immediately went right below the right rib cage here, and I pushed, just push. I said, "Is that tender?" And she about flew off the table. That's right where your gallbladder is. Her dad was in the corner of the room sitting in a chair, and his eyes just got wide open. And my treatment for her basically, essentially, was to help her remove some of the sludge and congestion that was in her gallbladder. I gave her some supplements. I actually had her taste the supplement that I had in the office, taste it, and then try to squat back up and down again. And she squatted up and down with zero pain. And it doesn't always happen that way, but in this case it did. And again, the dad almost fell off his chair because he couldn't believe it, because he hadn't seen his daughter squat up and down like a catcher all the way down. And it was like 3-4 weeks. She just could not do it. She struggled to even get this far without tasting that supplement. And there's reasons for that, of why that works. It's not hocus pocus. It does work. It works quite often. I do it all the time. But that connection was huge. So it took a couple of days, and she was feeling night and day different, and she went on to finish the season. Her first baseman was happy because they got their catcher back, and she was a senior, so it was her last year. But we have to consider this gallbladder connection with knee pain. It sounds strange to most people at first because we're so used to thinking, Americans for sure, and probably other parts of the world, so used to thinking of everything as compartments. Your body does not work as compartments. I do not know why the popliteus and the gallbladder go together. I have no clue. But I see it time and time again based off of the testing that I do, and then helping people to do different strategies to cleanse their gallbladder out and kind of relieve some of that congestion. And again, I don't know why. I don't know why it works, but it does work, and it works very, very well. So subscribe this to my channel, and if you want more information, drlarsen.com is my website, and I'll see you again on the next video.